Okay. Good day, Ma'am Medane Agon. I am Raquel Jane Sijalel, a nursing student from BSN 1A. So for today, for today's video, I'm going to perform the rhetoric demonstration about the thorax and lungs assessment. So, in assessing the lungs and thorax, we use visual inspection and also palpation and percussion and auscultation. So in the preparation phase, the first thing we need is prepare all the necessary equipment. And for this is to organization, facilities, accurate skills problem, and also to save time and effort. So the equipment required for this assessment is So the equipment required for this assessment is the good lighting. So we have a ring light here to assume that it is a pen light to see the patient result clearly, and also during the assessment. So I have gloves here to where to use during the whole assessment to avoid bacteria and also the viruses transfer. So, examination gown and drape to protect the patient from the spread of infections. And also the stethoscope to use the assessment, and also the alcohol swab to avoid the spread of viruses. So now, let's go to the patient room. So I pretend that I'm going to the patient room. Knock, knock. Sir, good morning. And so now we introduce ourselves to inform the patient of who she assessing with, and also identify the patient to ensure that we have the correct patient in front of us. So, sir, good day. I'm Raquel Jane Sigilo, your student nurse for today. So, for this assessment. So, prepare the patient to be ready in the assessment, and also the environment to have the successful assessment. So this place is warm, and also it's not cold here in this place. So, and also explain the procedure to the patient to avoid provide information faster, and also cooperation and understanding to our patient. So for this procedure, sir, I'm gonna inspect, also palpate, percussion, and also auscultation about the thorax and also the lungs. So position the patient appropriately to make and get the accurate result of the assessment. So, sir, can you sit properly, sir? So, and also make sure the room is warm and quiet, and also adequately lighted to perform the assessment. So we have ring light here to have a good light. So ensure the patient privacy to maintain the client privacy, and also the minimize embarrassment. So I assume that we have a curtains here. So I will be closing here close the curtain. And also obtain the health history to gather subjective data, and also the patient from the patient. Sir, what's your name, sir?
Datsun P. Ramos.
Datsun P. Ramos. How about your age, sir?
18 years old.
Where do you live, sir?
Pagadian.
Your birthday, sir?
September 18, 2003.
Okay, thank you, sir. So, wait lang, sir. So, I'm gonna ask some questions, sir, if it's okay. I would like to know, have you ever had a past history, any sickness and any sickness, any sicknesses in your lungs, and that means do you have a had pneumonia or bronchitis?
No.
Anything? So very good, sir. So have you ever had a trauma or accident recently?
No.
Okay. So have you ever been a smoker, sir?
No.
So do you in your how about in your environment, sir? Does many people in your a place that make that is a smoker that you make your a second smoker?
No.
Okay, sir. So have you experienced shortness of breath, perhaps like during exercise or running?
No.
Okay. All right. Thank you, sir. So next is wash hands to prevent the spread of germs like bacteria and also the viruses. So I'm gonna go to bathroom to wash my hands to perform a hand wash. So next is conduct complete physical examination and follow the proper sequence to perform the assessment properly. So, sir, Mr. Ramos, so before we start, may I ask if it's okay with you to touch some parts of your body to do our assessment?
Yes, ma'am.
Thank you, sir. And now we are done our preparatory phase. So let's start in the performance phase. So before I start, I'm gonna wearing gloves. Sir, can you please wear this examination gown, sir? Okay, share your shirt, sir. So next is So first we are going to perform Mr. Ramos inspection of anterior and lateral thorax. So in this, we need to position the patient to perform the assessment properly, and the patient should be in sitting position with cloth removed except for an examination gown entry. So we need to stand in front of the patient for the anterior and inspection, and to the side of the patient for the lateral inspection. So lighting must be adequate to detect the color of difference, the lesions, and also the chest movement. So we need to observe the skin color to know if it's normal or not. Pink is understone, indicate the normal oxygenation. Then also the skin color of the thorax should be consistent with the rest of the body. So okay, so we need to inspect the structures of the thorax to know if it is the normal or not. So the clavicle should be at the same height, and also the sternum should be in the middle line. So and also inspecting symmetry to know if it's normal or not. So the structures of the chest and also the chest movement should be symmetric. So inspect the chest for configuration to know if it is normal or not. So last, we need to count the respiratory rate to count the number of respiratory cycle per minute. So next, Mr. Ramos, the inspection of the posterior thorax. So first, we need to observe the skin color to know if it's normal or not. Should be consistent with that of the rest of the body, and also inspect the structure of the posterior thorax to know if it is normal or not. So the height of the scapulae should be even, and also the vertebrae should be even. Sir, can you turn around, sir? Thank you, sir. So we need to inspect the symmetry to know if it is normal or not, and also the structure of the chest, and also the chest movement should be symmetry. So lastly, we need to observe the respiration to know if it is normal or not. So the respiration should be smooth and also even. So Mr. Ramos, we're gonna palpation of your posterior thorax. So we need to lightly palpate the posterior thorax to know if it's normal or not. So we need to use our finger pads to lightly palpate the symmetric areas on the posterior thorax. So include the entire thorax by starting at the areas above the scapula, and also moving from side to side below the 12 rib, and also the laterally to maxillary on each side. So we need to assess for muscle mass, and also assess the growths, nodules, and also the masses, and lastly is the assess the for tenderness. So next is we need to palpate and also count the ribs and intercostal spaces to know if it is normal or not. So we need to instruct the patient to flex the neck around the shoulder and lean to forward, and also instruct the patient to breathe normally, and to tell you the pain or discomfort, and also we need to use the finger pads to palpate each spinous process, and also there are um, so so there are 12 ribs and also 11 intercostal spaces. So next um, next is we need to palpate the respiratory expansion to know if it is normal or not. So we need to place the palmar surface of our hands with the thumbs, and also close the vertebrae and on the chest at the level of T10. So pinch up some skin between our thumbs, and also ask the patient to take breath, and that's it. So Sir, please take a breath, sir. Sir. Thank you, sir. So, next is, lastly, we need to palpate for tactile firmitus to know if it is normal or not. So, we need to use the ulnar surface of our hand or palmar surface. So, of the hand, of the base of our fingers. So, at the metacarpophalangeal joints, when palpating, palpate and also compare the symmetry area of the lungs by moving from side to side, from apices to base at from apices to bases as the patient repeats. So 99 or 1, 2, 3 in a clear, loud voice. So, sir, can you say 99, sir?
99. 99. 99. 99. 99. 99. 99. 99.
Can you say again, sir?
99. 99.
So, next, Mr. Ramos is the percussion of the posterior thorax lungs. So we need to percuss the lungs of our patient to know if they have any abnormalities, and place the pleximeter in the intercostal spaces, and also the parallel to ribs during the percussion. So, standing lightly to the side of the patient allows the pleximeter finger to lie firmly on the chest as a move through the thoracic area. So, percuss on the apex of the left lung, and then the apex of the right lung. So, percuss from the side to side, and also compare the sounds in the intercostal spaces are you percuss to the bases of the lungs, and also the laterally to each midcellary line. So here in the posterior chest is the percussion is we need to find predominant notes over our lung fields, and also begin the apasis, and also use the same pathway to the side. So, okay, sir. So next, Mr. Ramos is escalate of the posterior thorax and lungs. So first, we need to instruct our patient to perform the assessment properly. So we need to visualize and also visualize the landmarks. And also we need to explain that you will be listening to patient breathe with the stethoscope. And also the patient will be in the same position as during the percussion. And also ask the patient to take a breath deeply through the mouth each time, and also the stethoscope is placed on new spot. So tell the patient to let you know if he or she become tired and short of breath and are dizzy. So if this so, it will be stop a long time and rest. So can you take a shot, sir? Take a break, sir. Take a break, sir. Take a break, sir, please. Take a break, sir. Thank you, sir. So next is we need to escalate for the bronchovascular sounds to know if there's any abnormalities. So the right and left pulmonary bronchi are located at the level of T3 and T5. So escalate at the right and left to the vertebrae. So at those levels. So wait. So lastly is also the vascular sounds to know if there are any abnormalities, and also escalate the lungs by following the pattern used the percussion, and also move the stethoscope from the side to side while comparing the sounds. So can you take a break, sir? So next sir. So take a breath, sir. Yes, sir. Thank you, sir. So next is the palpation of the anterior and lateral lungs. So, sir, can you turn? Yes, sir. So, the first thing we need is to we need to position our patient to perform the assessment properly. So, can you see properly, sir? So, the patient is usually in the supine position for palpation, percussion, and also the auscultation of the anterior and thorax. So if the patient is experiencing discomfort or dyspnea, sitting position may be used, or the patient may be in the Fowler position. So palpate the sternum, ribs, and also the intercostal spaces to know if there are any abnormalities of this. So we need to locate, and we need also to locate the suprasternal notch, and also palpate downward to the sternal angle, while the manubrium meets the body of the sternum. So palpate also the laterally to the left and also the right location, the second rib, and also the second intercostal space. So continue palpating the sternum and also to the expoid process and the left and right sternum to the count of the ribs. So I can take this one. So they are 12 ribs and also 11 external costal space. So, and also, I'm gonna palpate also. So can you raise your hands? Okay, sir. Thank you, sir. So, lastly is we'll palpate the anterior and lateral thorax to know if there are any abnormalities of this. So we need to use the finger tab to lightly palpate the symmetry areas of the anterior thorax, and also include the entire thorax by starting at the areas above each clavicle, and also moving from side to side to below the costal angle, and also laterally to midcellary line. We need also to assess muscle mass, uh, and also assess the growths, nodules, and also the masses, and lastly is the tenderness. So I'm gonna palpate, sir. So we need to palpate for the respiratory expansion to know if there any nerve abnormalities of this. So we need to place our palmar surface of our hands along each costal margin. So with thumbs close to the mid-sternal line, and also pinch the skin between the thumbs, and also ask the patient to take a breath. So sir, can you take a breath, sir? Thank you, sir. So, lastly, we need to palpate tactile firmitus to know if there are any abnormalities. So we need to use the ulnar surface of our hand, and also palmar surface of the hand at the base of the metacarpopharyngeal joints when palpating for the firmitus. So palpate and compare the symmetric areas of the lungs, and also moving side to side from aphysis to the base of the patient, and repeat also the 99 or 1 2 3 in a clear loud sound. So sir, can you say 99, sir?
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, thank you, sir. So, Mr. Ramos, so next is the percussion of the anterior and also the lateral thorax. So we need to visualize the landmarks, and also recall the inspecting findings, and also instruct the patient to perform the assessment properly. So we need to observe the anterior thorax, and also visualize the horizontal and also the vertical line, the level of the diaphragm, and also the lobes of the lungs. So lastly, we need to percuss the lungs. So we need to begin at the aphysis of the lungs. Ask the patient to turn the head to opposite side, and place the fleximeter finger and avoid interference from the clavicle. So move the chest wall and also place the fleximeter in the intercostal bases parallel to the ribs, and also during the percussion and percuss in the anterior chest from the side to side. Compare the sounds in the intercostal spaces. So percuss to the bases and also laterally to the maxillary line. So okay. So next, last to perform assessment the auscultation of the anterior and also the lateral thorax of and also the lungs. So the first, the auscultation, uh, the trachea to know if there are any abnormalities. So place the stethoscope over the trachea above the supraexternal notch. We will hear the tracheal breath sound, and also move the stethoscope to the left. So then the right side of the trachea, just above the each sternoclavicular joint, and also the bronchial breath sound are heard. So take a breath sound. So can you raise your hand, sir? Huh? So, sir, next is we need to auscultate. We need to auscultate the anterior and also the lateral lungs to know if there are any abnormalities of this. So we need to auscultate the lungs by following the pattern for the percussion, and also move the stethoscope from the side to side and also compare the sounds. So move down to the six intercostal space and also the lateral of the maxillary line, and also osculating the lateral lungs as the patient is sit up straight and with the patient arms raised his over his over his head, and also vesicular descents and also heard and also are heard. Okay, please. Can you raise your hand, sir? So, thank you, sir. So lastly, we need to interpret the findings of the assessment to know the accurate result. So, sir, this is the findings about the assessment. So, the skin color of your thorax are the consistent with the body color, and also the clavicles are the same height, and also the structure of your chest are symmetry. So, and also the respiratory rate is normal, is 15 cycle per minute, and also the respiratory is smooth and also even. So the scapulae are even, and also vertebrae is in the midline, and also the muscle mass are firm, also smooth. So that's it, sir. So now we're gonna done in we are done in performing phase. So this procedure, so let's proceed to others. So we need to make the findings of the health assessment and physical examination done on the patient to know the patient about, and also the findings, and to know if there are any problems or abnormalities. So earlier I said the normal findings, and also, sir, do you have any questions, sir, about the assessment? Okay, sir, thank you. So next is we need to wash our hands to prevent the spread of germs like bacteria and also the viruses. So I'm gonna go to bathroom to perform a hand washing. So that's all, and thank you. And that's all for the thorax and also the lungs assessment. So, sir, can you wear your t-shirt, sir? Thank you, sir.